Hi everybody, I'm Dr. Judy Goldstone from the Southern California Center for Anti-Aging. I hope you're all taking good care of yourselves and staying healthy, especially during this really tough time of COVID. It's been hard for everybody. But I want to talk about some good news, and that is peptides. Peptides are important, and they have become my favorite therapy to use as part of an anti-aging program. Peptides are an important therapeutic intervention for many reasons, but now using peptides is particularly important because they can bolster your immune system, and they can do it in a natural way to help our bodies stay well and strong. Natural, that's wonderful. I'm really excited to talk about peptides because I love the amazing results that my patients are getting and that I'm getting too from using them. They're so awesome and cutting edge that they've revolutionized the field of anti-aging and regenerative medicine. As a matter of fact, using peptides is the single best anti-aging treatment you can do for peak wellness. That's because peptides heal and repair the body very naturally. So what are they anyways? Well, peptides are short chains of amino acids. Remember, proteins are long chains of amino acids, and amino acids are the building blocks of protein. So what happens is a peptide is a very tiny amino acid block or a fragment of a protein. For example, when we eat meat or any kind of protein, it gets broken down into smaller proteins. And those smaller proteins get broken down into peptides. Eventually, the peptides get broken down into amino acids and absorbed into the body through the gastrointestinal tract. Our bodies make naturally hundreds of peptides, and they're found in every cell of the body. What makes it so unique and exciting is that each peptide causes an exact function in the body, and it can be isolated by scientists to do exactly that function. They're very safe, they're natural, there's minimum to no side effects. They're not new though. One thing that you need to know is they've been around and well studied and used in Europe and Russia for a very long time. The difference is in the United States, they've been mostly used to treat disease until more recently. For example, insulin was the first peptide developed. It's been around since 1940s, a few decades at least, maybe more. Peptides have been used for sports medicine. Some peptides have special functions, being able to repair and heal or even enhance body functions quickly. Now, they've moved into the area of anti-aging medicine. And what's different is the scientists have been able to figure out how to keep the peptides stable in the blood for at least 20 minutes. They're very fleeting. They disappear quite quickly, but now we've thought of a way to keep them more stable. I'm going to mention a few peptides and their functions because there's too many to discuss in this video. That's a topic for another video. So we already talked about healing and repairing. That would be a peptide called thymosin beta 4. And then there's anti-aging peptides like sermorelin and ipamorelin, which I've been using successfully for years instead of human growth hormone. These secretagogues and stimulators of growth hormone allow us to have the same effects as injecting growth hormone, but without growth hormone. We're just secreting and stimulating our own. There are also peptides like thymosin alpha 1, which is an immune enhancer, which is quite popular in my practice now because of COVID. People are using it to prevent getting sick. There are peptides that help anxiety and depression. And one thing that I'm really proud of is I've been able to get off people on multiple depression and anti-anxiety meds by switching them to peptides. Another use is cosmetic, which I love. We mix multiple peptides together for increased benefit. These are usually in the form of creams for repairing wrinkles increasing collagen, and they even have a cream now that has a Botox-like effect. And I have a mixed cream which does most of these functions. There's also peptides for weight loss and inflammation, autoimmune disease. There's so many. Peptides naturally decline in our body as we age, so replacing them is a way to regenerate the body and stay healthy. Peptides work very well with other peptides, with hormones, with supplements, and they're easy to fit into a wellness program. To get the best results, you want to add peptides to your current health and wellness program. You want your body to be completely optimized, and then peptides will help augment that. Peptides are completely natural. Again, they mimic something that's already in your body. They're made by compounding pharmacies, and I get mine from a pharmacy that has only pure, well-researched and field-tested peptides, as opposed to some that are available on the internet. I'm very suspicious of those. I heard something about only 80% of those are false. They're not really what they say they are. Peptides aren't stable for very long, as I mentioned before, so several have to be injected just under the skin, like subcutaneous with the insulin needle. But there are also some that are nasal sprays, and there are even a few oral peptides. They're a big part of my anti-aging programs now because we all love the results. The patients love the results. And they really help me get people into tip-top shape and maintain their health. If you're interested in hearing more about peptides or adding them to your regimen or getting started with a regimen, please call Dr. Judy Goldstone,